We recommend starting with axillary block to self-teach probe and needle handling in plane. With each axillary block, you can practice in-plane needle insertion for each of the 4 nerves that require blockade. We recommend scanning the area to make adjustments to the machine setting prior to the actual block procedure. Apply some coupling gel on the probe surface or on the proximal axillary crease. Apply the probe horizontally across the proximal axillary crease, perpendicular to the long axis of the axillary artery, with the notch directed laterally. Move the probe medially or laterally across the axillary crease until you can see a pulsatile artery in the top portion of your screen. Position the artery in the middle of the screen. Adjust the depth to magnify the view of the artery and its surrounding structures. The triceps fascia is seen as a hyperechoic curved line underneath the artery. The triceps muscle appears below this fascia as a hypoechoic fibrillar structure. If the artery looks small in the image, reduce the depth until you are able to visualize the artery and its surrounding structures. Adjust the dynamic range and/or gain so that you can see the nerves and vessels clearly. Adjust the probe vertically until you get a good end-on view of the artery. The nerves are seen around the artery as round hypoechoic structures. They often look like a bunch of grapes. These structures are non-compressible. Median nerve may be seen between 8 o'clock and 1 o'clock position, the ulnar between 1 o'clock and 4 o'clock position, and the radial between 4 o'clock and 7 o'clock position. Their position will vary depending on how much the arm is abducted. Observe the 2 muscles lateral to the artery on the blue dot side of the screen. These are biceps brachii superficially and the coracobrachialis deeper to it. The fusiform or round stippled structure seen between these 2 muscles is the musculocutaneous nerve. This is non-compressible. Move the probe proximally towards the apex of the axilla. As you observe this neural structure, move towards the lateral edge of the axillary artery. When there is significant pressure applied on the vessels, the veins can be compressed and are not seen. Relax on the probe while maintaining the contact with the skin. You should see anechoic or hypoechoic round structures appear on either side of the artery. These are the veins. Turn on the color Doppler by pressing the color button. A rectangular box appears on the screen. The slant of this box can be adjusted by pressing the button just below the icon indicating the box on the screen. Position the window to cover the area of the vessels using the mouse pad. Pressing the Select button and dragging on the mouse pad can help you size the window. Complete sizing by pressing the Select button. You should see the arterial pulsations as red and the venous pulsations as blue. The color will depend on the orientation of the probe to the flow of blood. If the flow is towards the probe, it will appear as red, and if it is away from the probe, it will appear as blue. This orientation is also determined by the vertical red-blue color bar on the top left corner of the screen. Note the nerves are not seen clearly in the Doppler mode. To return to the 2D mode, press the 2D button. The identification of these vessels allows you to plan the trajectory of the needle insertion, avoiding vascular punctures. With practice, you will be able to complete all of the above within 3 minutes. Now the machine is set for the actual procedure.